Hello and welcome to Froedtert and the Medical College of Wisconsin's pre-kidney transplant program. My name is Leah Meidlach and I'm one of the advanced practice providers on the medical team. I'll be part of the team that helps assess your medical history in relation to undergoing transplant surgery, as well as discuss some of the medical risks and benefits that come with getting a kidney transplant. Today we're going to introduce the major components of what's involved in getting a transplant. You'll hear from multiple members of our team, including some of our transplant nephrologists, other advanced practice providers, transplant surgeons, pharmacist, social worker, financial liaison, dietitian, as well as some of our transplant nurse coordinators. When we see you in person for your in-person evaluation, we'll answer any further questions you might have, as well as discuss further details related to your specific cause of kidney disease. We'll also discuss other important aspects related to your medical history that might play a role in kidney transplant. There are two treatment options for treating kidney failure: kidney transplant and dialysis, whether that's hemodialysis or peritoneal dialysis. Keep in mind that these are both treatments and not a cure for kidney disease. In an ideal candidate, kidney transplant is the preferred method of treatment for kidney failure. Data shows that these patients live longer and have a better quality of life with transplant as compared to those on dialysis. Those with transplant are able to travel more easily and don't have the time commitment required to complete dialysis on a nightly or 3 times weekly basis. There's also the possibility of returning to work after recovering from receiving a kidney transplant. However, transplant does come with its risks. These risks include increased risk of infection, increased cancer risk, as well as the possibility of developing diabetes or worsening cholesterol. Dialysis does come with risks as well. These include, but are not limited to, development or worsening of certain cardiovascular diseases, muscle cramps, low blood pressure during treatments, and increased risk of infection. Sometimes, however, when comparing the risks of dialysis to the risks of transplant, dialysis may be the safer option and kidney transplant would not be recommended. Prior to listing a person on the kidney transplant wait list, we need to ensure that you're a good candidate. We need to make sure that you are healthy enough to undergo transplant and in the best shape possible at the time of surgery. This helps ensure that the benefits of transplant outweigh the risks. If review of your testing indicates any concerns and it's believed that the risks of transplant would outweigh the benefits, you will not be placed on the transplant wait list. For some patients with certain medical conditions and risk factors, dialysis may actually be a better treatment option for their kidney failure. If the status of your health is believed to be stable for transplant, you will be placed on the transplant wait list with ongoing monitoring of your health while waiting for the transplant to occur. Potential kidney transplant recipients will need to complete a medical workup to ensure their body is healthy and strong enough to receive a kidney transplant. This testing is completed initially prior to active listing for transplant, as well as at regular intervals while on the transplant waitlist to ensure that you remain a good candidate. Testing may include some or all of the following, plus any additional testing the medical team requests based on your specific health history. Testing may include things such as labs, CT imaging of your chest, abdomen, and pelvis, cardiac testing including stress tests or cardiac catheterizations and echocardiograms, specialty consults, as well as routine cancer screenings including mammograms, pap smears, colonoscopies, and prostate levels in your blood. It's important to know that through this workup, we may find out you have other health conditions that you may not have been aware of prior to this testing, including things such as cancer. Upon completion of the initial workup, your testing will be reviewed by the medical team and a determination to proceed with listing for transplant will occur. If any testing finding indicates that transplant would not be safe for you, it will be recommended that you do not proceed with transplant at our center.
Transplant is not for everybody. The last thing that we would want to do is make someone's life worse after transplant. So it's our job to try and identify those who will be successful with a kidney transplant. Certain conditions or contraindications to getting a kidney transplant, including active cancer. If someone has a history of cancer, there might be a certain amount of waiting time that they need prior to being able to be eligible for a transplant. Those who have active substance abuse are also not candidates for transplant at this current time. If they have advanced diseases, that's something that we will take into consideration. but it could deem that they're not appropriate to get a kidney transplant. Ultimately, the last thing that we would want to do is complicate a patient's life more by giving them a transplant. So the goal is to make your quality of life and length of life better with a transplant. Some medical conditions might not exclude you from getting a transplant. However, they might make receiving a transplant more complicated and could ultimately impact your outcomes after receiving a kidney transplant. Us as a medical team will assess your past medical history to better evaluate your chances of success after getting a kidney transplant.
For many people, transplant may be an excellent option for the treatment of end-stage kidney disease, but there are risks that come along with transplant. While some of the risks are due to the surgery itself, many of the risks comes from the medications you will need to be on after transplant to suppress your immune system. The job of your immune system is to protect your body from anything that doesn't belong or that may be dangerous. This is usually good, as it protects you from infections caused by bacteria, viruses, fungi, and even cells that may become cancer. When you get a kidney transplant from either a living or a deceased donor, your immune system will know that that kidney doesn't belong to your body. It looks different, and if we do nothing, your immune system will start to attack the kidney. This is called rejection, and we want to avoid this as it can cause the transplant to eventually fail. Your immune system will be suppressed with medications, which will be discussed by the pharmacist in more detail. The major risks after transplant we will review are infections, cancers, and then some other risks. There are also side effects specific to each medication, which will be discussed by the pharmacist. Due to the medications that suppress your immune system, you will be at higher risk of infection after transplant. You may get common infections more often. These can include urinary tract infections, lung infections, and skin infections. You may also get more unusual or rare types of infections. These infections are not common in most people, but they take advantage of the fact that you have a lower immune system to make you sick. These include viruses such as CMV, rare bacteria, and even fungal infections. There are some important things you can do to help reduce your risk of infection. First, you will be on preventative antibiotics and antiviral medications after transplant. Second, we recommend that you stay up to date on the vaccinations recommended by your transplant team. Remember to frequently wash your hands, avoid people who are sick, and wear a mask in large crowds. Finally, it is very important to let your post-transplant team know if you are sick or not feeling well, so that we can make sure that you are getting the correct treatment.
All donors, whether living or deceased, are screened for infections prior to donation to give us a better idea of the risk of transmitting a disease to the recipient. While our testing is really good, nothing is 100%. There is a small chance that this testing could miss something and the recipient could become infected with a bloodborne disease. For this reason, we will recommend routine testing after the transplant.
Your immune system also helps to detect and protect from precancerous cells. With immunosuppression medications, you will be at higher risk of developing certain types of cancers. Your risk of skin cancer is greatly increased. Transplant patients will need full-body skin exams yearly with a dermatologist or skin doctor. Other measures you can take to reduce your risk include using good sunscreen, hats, and protective clothing. We will also monitor for kidney cancer of your old kidneys. Over time, you may develop cysts that can become cancerous. This is done with an ultrasound every few years. It is also important that you stay up to date on your age-appropriate cancer screening, such as colonoscopy, prostate tests, mammogram, and pap smear. You will also have an increased risk of developing diabetes after transplant. This is the result of immunosuppression medications and how insulin is handled by your body. If you already have diabetes, your blood sugar may become higher and you may need an adjustment in your diabetes medications after transplant. Diabetes can be treated with dietary changes, oral medications, and injections like insulin. Good blood sugar control is important to keep your new kidney healthy. Other risks after transplant include weight gain and worsening cholesterol. You will also still need to manage the medical problems that you had before transplant, which may include heart disease, stroke, or other conditions. It is important you work to maintain a healthy diet, weight, good blood pressure control, and blood sugar control, which are important to prevent damage to your new kidney and important for your overall health.
Prior to receiving a kidney transplant, we'll review your vaccination history and your exposure history. Based on this, we might make recommendations to get certain vaccines before you get a kidney transplant. This is important because your chances of having a successful response to a vaccine after a transplant are reduced. We know that certain immunosuppression meds make our chances of having a good response to the vaccine lower. For this reason, it's ideal to receive these vaccines prior to your transplant because your immune system will have a better chance at responding.
After you leave the hospital, you'll be monitored closely with the labs and office visits to watch for any potential complications. These complications include, but are not limited to, delayed graft function, rejection, and recurrence of disease. One of these complications is called delayed graft function. Your kidney has been through a lot before it gets to you, so there's a chance that your kidney transplant may not work right away. Some people do require dialysis for a short time after transplant until the kidney really starts working well. Another possible complication is called rejection. If your immune system recognizes the transplant kidney, it might attack it, which is also known as rejection. This can lead to damage or failure of your transplanted kidney. If rejection does occur, you may require readmission to the hospital, IV medications, further treatments, and closer monitoring with labs. It is important to know that even with treatment, the kidney function may not fully recover. The best way to prevent rejection is by never missing your medications. It is also important to complete all labs in a timely manner so that if rejection does occur, we can catch it early. Another complication is called recurrence of disease. Some diseases that can cause kidney disease in your own kidneys can recur in a transplanted kidney. We always consider your original cause of kidney disease when developing your post-transplant plan of care, including your medication regimen, additional treatments, and testing. Additionally, diseases such as obesity, hypertension, and diabetes can also affect your transplanted kidney. Therefore, good weight, blood pressure, and blood sugar control are key to making your new kidney last as long as possible.
If you do suffer from one of those complications, you may need a kidney biopsy. If we see abnormalities in any of your kidney labs, we may recommend a kidney biopsy. Kidney biopsies are used to help determine the cause of the lab abnormalities, which can then help guide your treatment plan. You also may need a readmission. Sometimes after kidney transplant, issues can arise that require readmission to the hospital. This allows us to take the best care of you and your new kidney. It is important that you remain available and that you have a transportation plan in case there is a need for readmission to the hospital.
Transplant is a treatment option for your kidney disease and not a cure. You will still be a patient if you receive a transplant and will have medical conditions that need to be managed. Transplant is a team sport. It is important to know that you will need to have a primary care provider to manage your routine medical needs that are not related to your transplant. You may have additional doctors that you will need to follow up with as well. For example, a cardiologist, a dermatologist, or an endocrinologist. Another critical team member is your support person. Having support is key to your success not only during the evaluation process, but in the months and years following a transplant. You have reached the end of this educational video on kidney transplant. Our hope is that you will feel better prepared for your kidney transplant evaluation if you feel that transplant is the right option for you. Feel free to share these educational videos with your support team. Write any questions you may have down and share them with your transplant team. Thank you for choosing Froedtert and the Medical College of Wisconsin.